How does prolotherapy help ischial tuberosity pain? I might even say that Caring Medical is the ischial tuberosity pain capital of the world. Almost every day, I treat people with ischial tuberosity pain. The ischial tuberosity is the sit bone. So actually you sit on your ischial tuberosity. And look at how humongous this bone is, the ischial tuberosity. And folks don't realize, you have the front of the ischial tuberosity here, and it connects to the pubic area actually. And in the back here, it connects to the sacroiliac joint. So you can imagine, these are really, really important structures. The ischial tuberosity is a very big bone because the hamstring muscle is attached to the ischial tuberosity. So ischial tuberosity pain can have many causes. The most common cause is you have pain at the origin of the hamstring muscle. So when a person contracts their hamstring, if it causes them, they have ischial tuberosity pain, then it's caused by injury to the hamstring attachment. So I call that hamstring tendinosis. You obviously could have pain in the sacrotuberous ligament. So sometimes the pain is where the sacrotuberous ligament attaches. But just realize if you have pubic instability or sacroiliac instability, it could be manifest as ischial tuberosity pain. And I'll be honest, if you have a hip labral injury, if you have injury to your hip labrum, it's often manifested by ischial tuberosity pain. The reason being is you have an instability of your hip. Instability of the hip causes contraction of the hamstring tendon and hamstring muscle, and then what you actually feel is like a really bad pain on the ischial tuberosity. So a really good treatment is, of course, for ischial tuberosity pain is going to see a prolotherapist and getting prolotherapy. The reason being is a prolotherapist can examine all these areas and see exactly what's causing the problem. And so sometimes the ischial tuberosity pain is in the front. So in other words, if a person has a lot of tenderness here, it may be that the prolotherapy doctor has to treat the front of the ischial tuberosity plus the pubic ramus. So sometimes it goes up here. But more often than not, it's actually on the back. So you have to get prolotherapy on the back. And I'll be honest, you have to really get comprehensive prolotherapy. You can't just get one shot here, and think like it's going to resolve it. The ischial tuberosity is a humongous bone, so most likely the pain is caused by many different parts of the ischial tuberosity. So a person might need a prolotherapy injection there. So sometimes folks, will watch the prolotherapy videos and it's like, geez Louise, how can a guy get 20 shots in such a little area? Well, it may seem like a little area, it's actually quite a big area. And you got to remember, prolotherapy only works if you do prolotherapy where you have the pain. So it has to be where exactly you have the pain. And if you have the pain coming from multiple areas on the ischial tuberosity, you have to get the whole ischial tuberosity treated. It has to be enough solution. Like you can't just dink around and do like a little bit of solution. It has to be a lot of solution. And then the solution you use, it has to be a strong solution that you get enough of a healing reaction, inflammatory reaction to actually cause the growth and repair of the structures on the ischial tuberosity that are causing the pain. So if a person does that, there's absolutely no reason that you shouldn't get completely better with prolotherapy to the area.